Welcome. The Social Policy and Advocacy team of the Australian Association of Social Workers welcomes you to our webinar, Healthy, Just and Sustainable, Co-Building the Australia We Want. Before we start, the AASW respectfully acknowledges the Wurundjeri people who are the past and present traditional owners and ongoing custodians of the lands on which this seminar is being recorded. We pay our respects to their elders past and present, their ancestors and families, and to the elders of the other communities who are listening to and watching this webinar. So welcome. Our presenters for this webinar are Rachel Riley, the Manager of Social Policy and Advocacy, and then in alphabetical order, Charles Chu, Dominic Shika and Jade Pertel, who are Social Policy and Advocacy Officers. And I have to add that we have the technical support from Ray, our social work student, and I'm Angela Scarfe, the Senior Policy Advisor. Now, I'm going to start by introducing you to the AASW. We're a voluntary professional association. We have about 16,000 members out of about 30,000 social workers in Australia. All members affirm our code of ethics, which is based on the three values of respect for persons, social justice, and professional integrity. So the AASW provides a lot of support functions to members. For example, continuing professional development. We have developed a range of higher level credentials that members can achieve. We offer an ethics consultation service, and we also conduct forums, webinars, and conferences and events that connect members to each other and to the big picture issues that are happening around them. So, for example, for World Social Work Day this year, we held a webinar about the Sustainable Development Goals and what they mean for social work in Australia. Now, the last function of the AASW that we'll discuss today is the work of the Social Policy and Advocacy team. We're the team that advocates for human rights, social justice, and recognition of the profession. And to illustrate the way that the Social Policy team does that, I'm going to hand over to Rachel Riley, our manager.
Thanks so much there, Angela, for that introduction. Just to sort of, I guess, provide a bit of a background as we sort of move into how and what we do in the Social Policy and Advocacy team. First of all, just to note that our global governance systems are really a fundamental way of our life, whether we're aware of it or not, and most certainly intrinsic to how and why we do social policy. So for us at the Australian Association, we really do look to international human rights instruments like the International Bill of Human Rights and frameworks such as the Sustainable Development Goals, which are really about creating a shared vision and I guess a roadmap to ensure human rights for all are upheld. And we really draw on these sorts of instruments and frameworks as a guidance for our work. As many would know, ratifying an international human rights instrument is really signalling that the government has committed to respect, protect, and also fulfil their obligations to human rights, which are enshrined within the different instruments. And I guess for those that aren't familiar with those principles, respect means that the government cannot interfere with the rights of an individual and communities to enjoying their human rights. So for an example, a government cannot enact legislation or implement policy which is discriminatory. Protect means that the government has an obligation to protect individuals and communities from human rights abuses. So making sure that there aren't other actors or factors impinging on the rights of the Australian community. And fulfill is actually, it creates a positive obligation for the government to facilitate the enjoyment of human rights. So this is really, I guess, very intrinsic to our policy space here. So it's making sure, like the title of today's presentation, that the Australian government is creating a healthy, just and sustainable Australia. And these principles of respect, protect and fulfill have great synergy and alignment with the three principles enshrined in the AASW Code of Ethics. That is the principles of professional integrity, respect for persons and social justice. To this end, we anchored our recently developed and launched national policy platform to the 3 principles in the Code of Ethics, and our policy recommendations for reform were really in relation to the government upholding the international human rights obligations of respect, protect and fulfil. So this also, as hopefully you'll hear from my colleagues today, it does enable us to advocate for an intersectional perspective across a broad range of policy areas, rather than focusing or singling out a single policy issue. Even issues which on the surface may not appear as a human rights issue can in fact be linked back to the government's human rights obligations to respect, protect and fulfil, and to goals which are outlined in the Sustainable Development Goals. So an example of this is the AASW's very long-standing campaign around getting national statutory registration of the social work profession. So this statutory registration is actually an incredibly complex issue, and obviously we don't have time today to unpack that, and nor to acknowledge, I guess, the extraordinary amount of work that has gone into this campaign by many, many people. But I will provide an overview of how we presented the need for this to the government as part of our election campaign. So while our national policy platform doesn't go into this level of detail, the work that we were doing on the ground really framed the registration issue for the election campaign as an issue relating to the positive obligation of the government to fulfil the human rights for all Australians. So to do this, we did the following. We framed the issue as a quality, safety and standards issue, and the government has a positive obligation to provide services and supports of a particular standard to the residents of Australia who may otherwise not be able to ensure their human rights to, say, issues such as safety, health or housing to be realised or maintained. And as a quality, safety and standards issue, it also became a cross-portfolio issue, which could not be resolved through the siloed single ministerial portfolio approach that we have in Australia, such as a ministerial portfolio around health or mental health or around child protection. And taking this cross-portfolio approach enabled us to target the leaders of the 2 main political parties, and meant that they couldn't defer those issues back to a particular minister or relegate it back to a state or territory as having to resolve. And so with this framing, we positioned it that the whole of government is responsible for fulfilling the Australian community's right to the enjoyment of the highest attainable standard of physical and mental health. We argued without a registration scheme, the government is not fulfilling this positive obligation by providing services free from human rights abuses at the individual or the systemic level, particularly for the marginalised or vulnerable members of the community. So to this end, we can include the need for a registration scheme in pretty much all of our other policy asks that we have within our national policy platform. And likewise, if we turn to mental health, again, noting the government is responsible for fulfilling the Australian community's right to the enjoyment of the highest attainable standard of physical and mental health, our advocacy around this has largely been centred around trying to foster and break down that siloed and medicalised way of thinking about mental health. That is, really advocating that there is a need to shift the policy focus to broadening our understanding and responses to mental health to be based around the social and environmental determinants of health, which wholly aligns with the overarching agenda and plan of action contained within the Sustainable Development Goals. So my colleagues will all touch on this today as well. But if we don't look at health, housing, climate emergency, or the unequal impact of social issues on First Nations peoples as contributing to individual and collective mental ill health, then we won't be able to foster the vision that we want of a holistic and culturally safe mental health system in Australia, one that also acknowledges health as a human right and addresses inequity in access to the conditions necessary for health. So to this end, mental health weaves through almost all of our advocacy priorities as well. So this is how we've sort of approached our national policy platform from an intersectional framework, linking it back to our code of ethics, which has also then been benchmarked back to global governance systems. So I'm going to pass over to my colleague, Charles, who will talk through some more intersecting points that relate to income, mental health, climate, and potentially even gender equality.
Thank you, Rachel, for drawing our attention to social determinants of health, intersectionality, and how it's relevant to the global human rights regime. So at AASW, we actually want to reframe the conversations about income support as a baseline for the most vulnerable cohort in Australia to live a dignified life. In our policy statement, we particularly look at the following policies that may or might not be under the limelight for our politicians. First of all, it's raising the level of income support payment. Secondly, addressing gender pay gap. And the third, ceasing the trial of cashless debit card in which those placements can be quarantined for certain communities in Australia. I think we start from the first. The first one is in Australia, the level of income support payment has been the subject of prolonged activism. We actually consulted our member along the way that they have repeatedly nominated this as the most important policy reform they would like to see. Unfortunately, neither of the two main parties are promising to raise the level of payments at this election, despite the very real poverty experienced by people who depends on this for their survival. And one of the greatest examples I could provide how climate change really intersects with this is that people who have plunged into poverty and homelessness due to climate-induced natural disasters, such as the fire, the flood, they have lost their houses, possessions through these natural disasters. And as these disasters become more frequent due to the inaction from our government, many parts of Australia will eventually become uninhabitable. The impact of climate change is unfortunately not felt equally in Australia, as people who do not have financial resource usually struggle to cope with these drastic changes. And that's why we want the income support payment to be increased to a level that everyone's basic need can be met. And this is in alignment not only with the AASW Code of Ethics, but also with the basic human rights at the international level. Secondly, these perhaps not being spoken in the media discourses here is the gender dimension of income support policy. This has been completely sidelined in our election campaign, in the election campaign of major political party. We all know that across the globe, there's a gender dimension to income inequality in which women are generally paid less than men, while most of the primary givers are women. The current government does not have a plan to provide financial support for single parents, and such a lack of income support has a flow-on effect on increasing women's vulnerability to family and domestic violence due to their financial and housing insecurities. All of these have been drowned out in other political noises, and that's the reason why the AASW is willing to put that back to the limelight. Thirdly, the mechanism in which income support payments are administered has been incredibly punitive to marginalized community, in particular First Nations people and people living in regional and remote communities. In Australia, we have trialed a thing called cashless debit card, in which the government quarantine your income support payments so that it could only be spent in certain retail and hospitality outlets. From our point of view, from the AASW point of view, is undermining a person's self-determination, which go completely against our code of ethics and the person's and the basic human rights of a person. So we look at these three issues, and these all fall out from our code of ethics and our commitment to international human rights. As a response, we have participated in a long-standing sector-wide campaign that urges the government to raise the level of income support payments. We built coalitions with other health professionals in Australia to campaign for stronger climate actions. We work with our sectors to increase the housing outcome for all Australians, and utilize our policy statement to amplify our visions for a better Australia. All in all, it is in our belief that the government should provide adequate level of support for everyone living in Australia with the principle of self-determinations and human rights. So I will pass it on to probably a bit more on the side of self-determination. I will pass it on to my colleague Jade to talk about how reconciliation actions is woven into our campaign.
Thank you, Charles. And so all of the issues that we've been speaking about so far, they impact Indigenous Australians at higher rates than other groups. Social workers in the past operated quite differently and was part of the intergenerational generation of trauma for First Nations people through the practices of child removal called the stolen generations in Australia. The AASW published its apology for past social work practices to Aboriginal and Torres Strait Islander Australians in 2004 and advocates for a very different kind of social work to those practices. Currently, we advocate for registration and parity for Australian social workers to ensure that contemporary social work is recognised for a systemic lens on structural inequality, including institutional racism, for its holistic approach to supporting people in the broader context of their social environments, and in recognising the impacts of trauma and the importance of trauma-informed supports. Indigenous Australians came together in 2017 at the First Nations Constitutional Convention at Uluru, following a process of regional dialogues amongst representative groups of traditional owners, community organisations and Indigenous leaders. The Uluru Statement from the Heart emerged out of that gathering and called for self-determination through a voice to Parliament enshrined in the Australian Constitution and Makarrata Commissions for Developing Treaty and telling the truth about Australia's colonial history. The AASW supports self-determination and truth-telling and believes that reconciliation can also be aided by government supporting scholarships for Aboriginal people to study social work and develop a strong and culturally safe workforce, empowering and culturally safe care settings for First Nations children, young people and adults who find themselves in out-of-home care, disability and aged care settings. Service evaluation frameworks incorporate lived experience and recognise Indigenous systems of knowledge, and culturally appropriate mental health systems which incorporate cultural knowledge and engage with community to understand ways that mental health and mental illness are related to cultural safety in the broader service systems. The AASW also echoes the Family Matters report calls for a National Commissioner for Aboriginal Children. Consistent major inquiries in Australia recommend changes to practice that reflect social work approaches of holistic, trauma-informed care, and yet our governance systems are still directed to particular forms of auditing, compliance, and evaluation. As the Loitja Institute observes, funding from governments is packaged in ways that do not match the way that services are delivered on the ground, which leads to a high reporting burden on services. When Aboriginal health services are funded through a congregation of several discrete programs evaluated separately, this creates an administrative overburden for some of the least resourced communities in the country. This problem is replicated in Australian community services. And when we're talking about sustainability or even efficiency of services, this is a major problem for achieving outcomes for service users because staff spend more time on reporting requirements than they have to provide effective and much needed supports. Aboriginal people have been the subjects and objects of policy and research since colonisation, and they have witnessed the ongoing inability of government to demonstrate that they've listened and heard what communities tell them. Enshrining a voice to Parliament means Indigenous communities are included in the democratic process, and listening to Aboriginal and Torres Strait Islander people about how to care for land and country can benefit all of us who live here. Thanks.
And so now we're going to hear from Dominic.
Hi everyone, I'm going to talk a bit about how we think about climate change and integrate climate action into our social policy and advocacy work. So one of the roles I have in our team is the co-facilitator, along with Angela, of the Climate Action National Advisory Panel. We have 5 different national advisory panels that reflect the really important strategic priorities that we have in the work that we do. And we're really lucky to have the input of the panel members as our members on those panels that provide us really valuable advice. So they give us their advice on a voluntary basis. And they come from all kind of aspects of the social work profession. So from academia, so people lecturing and instilling the importance of eco-social justice and the next generation of social workers, or developing new research and theory and developing journals, or out there as social workers in the community who are also being activists and joining in the climate debates out in the communities. So our wonderful panel members give us insights and give us advice on how we should develop our policy and advocacy work. And just to put out a few reflections on that, we really purposefully call it the Climate Action National Advisory Panel rather than the Climate Change National Advisory Panel. So one of the reasons for that is to link our work back to that international framework, because goal number 13 of the Sustainable Development Goals is climate action. So we see ourselves as part of that global citizenship, all advocating for that just world that we want. It's also been really helpful in our team to as a constant reminder, to be active on climate change, to not just be passive participants and understanding policies and government policies, but that we're, as social workers and social work profession, out there kind of creating the change in the world that we want to see. In terms of our national policy platform that we put out this year, and we're just about to go into the election for Australia, we really made a considered effort to incorporate a substantial section around climate action, including a vision and recommendations to government, to the next government, about what they should be doing. And I just want to talk about a few reflections on that. Being in the social work profession, it's easy for people to think that social work would be limited to those social services and the social aspects of life, but entering into that climate debate and advocacy space is really important. So when we launched our national platform, we got press, media attention coming back to us with positive feedback, because they hear a lot from climate organisations and activist groups, but hearing from that social worker perspective, it gained more traction and it made it newsworthy. And we also had other organisations from the social services sector reaching out to us to say that they were really pleased to hear that we had climate action and advocacy in our platforms. And the other thing that we did on our platform, on the advice of our expert panel, was to link our work back to alliances and other organisations that are campaigning out there around in Australia for a more just, sustainable world. So we worked with one in particular, which is the Climate and Health Alliance. And part of that work is really about breaking down the silos between, like Rachel said earlier on, the health area, where people just are concerned about the medical health of people, and then climate and environment is another kind of ministerial portfolio. And our work has been integrated with theirs to bring in that social justice element. And so us being able to link back to their work and they to our work has been more powerful in breaking down those silos for more holistic advocacy. And I'll pass back to Rachel for the last part of our talk.
Brilliant. Thanks there, Dom. Thanks everyone, actually. You know, even though I'm sort of working in the team, I think I learned a lot listening to everyone's input, their thoughts and reflections on what we've produced as our national policy platform. So hopefully through the presentations across today, you've both heard our vision that's in our national policy platform and how we came to create it the way we did, and how that links back to the Sustainable Development Goals and the title of today's webinar, which is the you know, healthy, just and sustainable, co-building the Australia that we want. We know that there will be likely to be some social workers out there who are listening, who may want to get in touch. We've only touched on a few areas today of our policy areas, and again, trying to look at it from that intersectional perspective. For the social workers out there listening, hopefully there's somebody listening. The policy areas for social workers at times seems almost infinite. So we welcome any thoughts, comments, or feedback. On the screen here, you can see our email address that you can drop us a line. We'd really welcome it. And we hope that everyone listening enjoys the rest of the conference, the Eco Social World Conference. Thank you.